Hello and a very good afternoon to all of those joining me live on the Facebook page of News9. I'm Neha. Now, it's been close to a year since the entire world came to know about coronavirus pandemic, and ever since, we've been learning something new related to the complex nature of the virus. Many of us have already started letting our guard down, assuming we know how to deal with the virus, while many experts have been cautioning against it time and again. In a similar development, the World Health Organization said, "We are well behind the virus." WHO's emergency chief Mike J. Ryan said, and I quote, "We will have to get ahead of this virus, and that may require sacrifice for many people in terms of their personal lives." The WHO also said that they are hopeful that now COVID-induced lockdowns may not be implemented in most countries. But having said that, a few countries which are reporting higher number of COVID-19 cases may need to shut their non-essential businesses and impose stricter measures to curb the spread. Mike J. Ryan also said it may require shutting down and restricting movement and having stay-at-home orders in order to take the heat out of this phase of the pandemic. In fact, speaking about how lockdown really helps in curbing the spread of virus, the city of Melbourne in Australia will exit lockdown on Wednesday after registering no fresh cases of COVID-19. Now, to speak more on this, joining me over the phone line is Dr. Vivekananda Jha. He's a public health expert. Many thanks, Doctor, for taking out some time of your busy schedule and speaking to News9. My first question to you, sir, would be, WHO says in order to bring situation under control and get ahead of the virus, sacrifice from people is needed. What does WHO imply when they say sacrifice is needed?
Well, I think there are many meanings to this word sacrifice, and so we should take it really carefully and maybe dissect it a little bit. People, to be honest and to be clear, is that the people of the world have made a lot of sacrifices already. Sometimes voluntarily, sometimes because they have been directed by public health authorities, sometimes because they have been directed by the government. And this sacrifice level has actually led many people to even lose their jobs, their livelihoods, and so on and so forth.
Right.
But look, I think it is fair to say that some degree of a change in personal behavior is needed in order for us to develop appropriate public health measures to deal with this pandemic. And I would say what sacrifice should mean at this time is to make sure that we behave responsibly at all times, which is wearing a mask, maintaining appropriate physical distancing, practicing hand hygiene, and also looking around ourselves and making sure that people who are not following any of these norms, we remind them politely to do so, because it is good not only for them, but good for everyone else around them as well.
Right.
Right,
Dr.
also have...
Yeah, please go ahead.
I was just going to say that we have also made a number of changes in the way we live and we work, right? I mean, people have worked from home, so that has meant people making sacrifices, again, to achieve a good work-life balance, to make sure that they remain productive while getting used to, working in a very, very foreign manner. So all these sacrifices have also taken place. The sacrifices of elderly people who have had to really stay indoors because of the need to protect themselves, and also to help the society really get rest of the business out and running sooner, because for that they do require that the elderly should protect themselves while the society also protects them. So I think there have been sacrifices at all levels. School children having to learn online in a very, very difficult manner, something that they are not used to, and children are not expected to work like that. People with relatively limited means having to certainly get used to finding ways to educate their children. Some of these sacrifices will also actually end up with a long-term price also, which we will know only as time goes by, as to what is the impact of having to deal with children getting education in this very non-conventional manner, other students having to deal with examinations in a different way, and so on and so forth. So I think sacrifice has a number of meanings.
Right. Dr. Jha, there has been a COVID-19 resurgence in countries where the pandemic was on decline. Cases have been accelerating in the northern hemisphere for that matter. Now, WHO says some countries may need to impose strict measures, which includes shutting non-essential businesses. Would you say this is the right approach?
Sure. I think everything that we need to do to prevent the spread is the right approach because, mainly the most important thing is to get the infection under control, right? So some businesses will have to either curtail activities or even be closed down, which has happened. It's not desirable always, but then it has to be done, right? Because that may be the only way to prevent spread in some situations.
Right. So Melbourne, talking about Melbourne, Dr. Jha, the city will exit lockdown on Wednesday after registering no fresh cases. So is it time for other countries to also follow suit? But, there the bigger concern is economy. So how does one strike a balance between the two?
That's the million-dollar question, right? Literally the million-dollar question, or even the billion-dollar question as to how do we strike a balance. I don't think anyone has been able to figure that out, and I'm certainly not an expert to be able to provide an answer to that situation. I think Melbourne is reasonably justified in its decision to end the lockdown because, as you said, they have had no new cases. But the same is not true for other parts of the world. As you yourself said a few minutes ago, the number of cases in Europe, in North America, is rapidly rising again. So clearly, for them to follow suit, in terms of what Melbourne has done, is not the appropriate strategy.
Right. Lastly, Doctor, the cases are on decline in India. Number of recoveries are far more than that of active cases. People are freely roaming around, many not also following the COVID protocols. Is it time for the government to perhaps bring stricter measures to avoid what we call a second wave or peak in India? Because looking at the economy at this point in time, it doesn't look like we are in the position to enter into lockdown phase again.
Yeah, I think that's right. We are unlikely to see another lockdown being imposed. But for this current situation to really remain sustainable, we have to take some responsibility as citizens. And responsible behavior does include, as I said, following the public health advice that's given by public health experts and followed around the world. Because as we have seen that around the world is that entering a phase of decline often introduces an element of complacency, which is a recipe for disaster. And we have to learn from what is happening in the rest of the world, which is of the need to remain vigilant. Because you see, this infection is such that it doesn't remain confined. Unless we take care of everyone, everyone is at risk. So you can't say that we can impose some lockdown measures or we can impose public health restrictions only in certain areas and let other areas people in other areas do whatever they want. That's not going to work. So no place is safe until all places are safe.
Right. Thank you.
Concerted efforts.
Right. Thank you very much, Dr. Jha, for joining us with all of those important insights. Now, there is still time to make sure the numbers do not rise exponentially. All we have to do is to listen to the experts and take all the preventive measures to keep COVID-19 at bay. Most importantly, learn from other countries which have been reporting an exponential rise in the number of cases. Many thanks for watching. If at all you like this video, do not forget to subscribe Newsline Digital. Take care.